All right, each year we go to New Orleans and we cover the Cardiovascular Horizons Conference in New Orleans. And of course, if you know Dr. Craig Walker and all the local doctors here in the area, they put this on. It's just a worldwide event now. We can say worldwide event, and it's unbelievable. Well, we had Cole Walker, Jason Serenier, along with Sylvia Masters, made the trek this year, caught up with some important people to talk about the event this year, and it's always impressive and always growing.
Hi, I'm Sylvia Masters here at the new Cardiovascular Horizons 18th Annual Conference right here in New Orleans at the Roosevelt Hotel. We are going to catch up with several people who are participating in this year's event, one of them being one of the co-founders, Dr. Craig Walker. So what is the purpose of this conference?
New Cardiovascular Horizons Conference is in now its 18th year, but from the beginning, it was a meeting that was set up to better train physicians and healthcare providers to diagnose and treat peripheral arterial and peripheral venous disease. These are huge problems. There's actually more peripheral arterial and peripheral venous disease than there is heart disease, and it represents a larger economic burden to the United States, yet it's still widely underdiagnosed and widely undertreated. Many patients have amputations that really don't need amputations. That's certainly a shame. And many patients don't have the diagnosis made in the first place, which is really a great opportunity for us to identify sick patients. So the whole goal behind this is to improve patient care. And so we have live cases that come in from around the world, done by the world's masters, and the participants of this frequently call after and say, this conference really changed my practice. It allowed me to treat patients I couldn't treat before, and that's really what we're shooting to do.
And so tell me, what are some of the new technological advancements that you are currently working on with PAD?
Sure, there have been many technological advancements. You know, in the past, we really couldn't cross total blockages that were long. In today's world, given you guide wires and guiding catheters, not even really fancy devices, we can cross about 99% of all lesions. So historically, where people said maybe 20% could be crossed, it's really more like 99% in today's world. We have drug-elution balloons. These drug-elution balloons allow us to expand and open an artery, but certainly a coating of drug is applied to the vessel wall, and this drug lessens the chance of a blockage ultimately coming back. That's a very big technology. We've been working and have helped to develop an ultrasound delivery of drug. That yet further improves how much drug is taken up and that we can treat the patients with. We have stents that now have these drugs upon them that lessen the chances of a blockage coming back. So in today's world, we can treat more patients, we can treat them more safely by using things like CO2 instead of iodinated contrast to make our images. We can treat them where the blockage is less apt to come back, and because of this, more limbs are being saved and more lives are being saved.
And so tell me, why is it so important to train and educate these physicians from around the world with this conference?
Well, to start with, there really is a lack of understanding of the importance of peripheral arterial disease. There's always a gap, and always has been a gap, between medical science and medical practice. By that I mean medical science is advancing very quickly, but the practice of medicine has always a delay. Our goal is to shorten those two distances. We want medical science and medical practice to be on par. We want physicians and healthcare providers to understand what is the state-of-the-art science and to deliver that in their practices rather than wait 5 or 10 years for that to occur.
And tell me, why are you so passionate about treating PAD?
Well, I think peripheral arterial disease is really a monstrous problem. When someone has their leg cut off, to start with, the best centers in the world, a below-the-knee amputation has between a 5 and 8% 30-day mortality or dying, and above the knee between 8 and 12% 30-day mortality, not 30 years, 30 days. These patients continue to have pain because they have phantom limb pain. So many think their problem and their pain is going away. It does not. Fully 1/3 of all patients who have a major amputation because of ischemic disease will never ever get a prosthesis and walk again. 1/3 of them go straight to a nursing home, never to leave. So this is costing society a lot of money. It is far more expensive, associated with far higher death rates and much worse outcomes than limb salvage. So we really have to get this message out. It's a huge message, and it's not limited to the United States. This is a worldwide problem. We this year in March established the first dedicated limb salvage center in all of China, the whole country. And so this is a problem which is global. And we think that we can have a big impact on the world with this.
There are various purposes with this conference, especially the networking event, Meet the Titans, in which many physicians and other healthcare professionals are meeting to discuss the issues of the epidemic that is going on around the world, PAD. I am joined now with David Knor, CEO of Cardiovascular Institute of the South. David, thanks for joining us. Tell us, what is your role in Cardiovascular Institute of the South?
Well, I've been the Chief Executive Officer for the last 18 years, and my job is the overall management and direction of the group.
So tell me, what is CIS's involvement in this conference?
CIS actually founded this conference in 1999, New Cardiovascular Horizons, to educate podiatrists and family physicians and internists and cardiologists on the latest in the treatment of peripheral vascular disease. Cardiovascular medicine is moving so fast, and currently there are about 7,000 guidelines that govern the best practices in the treatment of cardiovascular and peripheral vascular disease. And so it's imperative to stay up to date on the latest best practices.
This event is kind of unique because it brings a lot of perspective from young fellows who are in training and very seasoned and experienced operators to talk about the arena of cardiovascular disease and especially vascular discipline, both arterial and venous.
And tell me, why is it so important to train and educate physicians from all over around the world about PAD?
So unfortunately, PAD is one of the very, it's an obscure disease. Not a lot of people know about it. The community's not aware of it. The primary care physician and the internal medicine physicians are not very aware of it. So part of NCVH, which is created by Dr. Craig Walker, the main vision is awareness for PAD and going out and training younger generations about how prevalent this disease is, how deadly it is, especially that it gets worse with age, with diabetes, with smoking, and all those are extremely prevalent risk factors that make the disease very important and such a huge economical burden to our healthcare system these days.
So tonight is it's a good social network here. We're meeting physicians or future physicians from all over the country, but more importantly, this course, the NCVH, the conference that we do, is incredibly important because we have people from all over the world, really, that are leaders in their field, and they're here sharing ideas. So we're here to learn from the best of the best.
And why is it so important to train and educate physicians and other healthcare professionals about this conference and PAD?
Well, first of all, it's important for everybody to recognize that PAD is such an incredibly debilitating disease that affects so many people. Most people go untreated, so we're trying to change that. But also, we're trying to show them all the new advancements we have in that field. In fact, at Terrebonne General with CIS, we have physicians from all over the country that come participate in courses, so we can train them on the new techniques. We all need to learn from each other because in the end, we're just trying to make everybody better and help everybody have the best outcomes they can have.
We're involved in a lot of telemedicine and opportunity to use electronics to reach people in remote locations to provide cardiac care for them. And so we're learning more and more of what that would look like and be able to reach more people through the business and learning the technologies. And so there's all the major vendors in the medical world are here today or for this week, and so they're sharing a lot of their new technology with us. And so every provider and nurse and respiratory therapist that work in the cath labs have the opportunity to go to those people and learn their products.
And that's all from the new Cardiovascular Horizons Conference right here at the Roosevelt Hotel in New Orleans. Reporting for HTV10, I'm Sylvia Masters.
Always impressive. We'll have more in that story for sure. It's always developing. We're always bringing you new technology with that. And be watching for the 3-part series on Dr. Craig Walker on my one-on-one program. All right, when we come back from the break, we're going to have Vanderbilt Catholic representatives here to give away $10,000 tonight right here on this channel to someone who gets picked in the raffle. And right after that, someone gets a $12,000 AC and heating unit from Lane's AC and Heating right here in the Eugene Falls studio. So in the Lorraine Falls studio, someone's going to win $10,000. In the Eugene Falls studio, somebody's going to win a new air conditioning unit. Don't go away.